I'm going to turn it over to Nicole Atong from Florida International University, and she'll introduce herself and her co-presenters.
Hi, good morning, everyone. Thank you for joining. We're hoping that this presentation is very dynamic. Please feel free to jump in and ask questions. The way it is set up, first we'll talk about students, and then we'll talk about the mental health and support of staff in our program. But before I start, I wanted to say a few words about me and about my co-presenter, Maite Capo, so that you understand where the lens for this came from. I am a mental health clinician by trade. I'm a psychotherapist. And I used to run the child welfare system for Miami-Dade and the Keys, as well as the children's mental health and substance abuse system for Miami-Dade and the Keys. Miami-Dade County and the Keys. And with me today is Maite Capo, who oversees the day-to-day operations of our education program. Maite is also a clinician and worked closely with me when I was overseeing the mental health and substance abuse system for the children. And Maite, while she's a clinician, she has spent a great deal of her work and energy around evaluation, data collection, quality assurance. And so Maite, go ahead and go to the next slide. And so when we came to Embrace, one of the things that came with us is this knowledge that there is a lot of stigma around mental illness, stress, burnout, post-traumatic stress disorder, all of that, because Maite and I have worked for SAMHSA, sort of working on a social stigma campaign to reduce stigma around those things. So we came with that lens and that feelings, and understanding the trauma that families go through when their child is born with a disability. We knew that mental or wellness in general has to be part of what we do. In addition, the whole meaning behind FIU Embrace, the whole vision is to improve the health and well-being of adults with developmental disabilities. And when we talk about well-being, it is beyond, and health, it's beyond physical health. So all of that, you need to understand that lens, that knowledge, that experience is weaved across all aspects of Embrace, and particularly into the education program. So what we really want to talk to you about today is, why is this such an important thing for us? Why it should be an important component of every post-secondary program, some of the strategies we use, and how do you identify stress, burnout, and anxiety in the staff and students. Go ahead, Maite, please advance. And so one of the things that we wanted to share with you is, it is more likely than not that that most of the students you have in your program, we know the rates of developmental disabilities, but when we combine those students getting a developmental disability and having a co-occurring disorder of anxiety, of depression, of OCD, or some externalizing behavior, those rates are much higher than we think it should be, or we believe. I think as a group, we speak about developmental disabilities and know their figures really well. 1 in 10 children, for children with autism, 1 in 68, we know that, but we don't really talk about the existence of co-occurring mental illness. Advance, please, Maite. And so when we go to the literature, we see that there is a vast range, almost a spectrum of if you will, high prevalence of of mental illness based on the level of impact of the individual. So some studies has it anywhere between 30 to 50%. Some studies has it at 60%. And really when you dive into the study, and in the reference page, you'll find some of those studies. When you dive into it, you understand that the level of mental health challenges is directly correlated to the level of impact of the intellectual disability. So one could assume, rightfully so, that the higher the level of impact is the greater the chance of that individual having an anxiety, having a difficulty managing their emotional stance. So I think that as we understand that the prevalence rate is significant for the students we are working with, we have to appreciate that there is a high comorbidity for our students having a mental illness or a mental health challenge. Maybe it doesn't rise to the challenge of clinical diagnosis, but then we must do something about it. We must give them the strategies to be able to work through that. Move forward, Maite. And so for me and for Maite and myself, as we were talking about this, embedding emotional health and embedding mental health within our program, we have really two audiences. One is the staff, and I include myself in that. Actually, we have three audiences. The other one is the students, and the third is the families. But if we stick with staff and students for this talk, we can see, and I'm sure you have seen this with your students, and staff, that there is a tipping point when stress and burnout moves someone to the edge. And so we have to be proactive in this and give both our students and staff the tools to be able to have emotional wellness, to be able to understand what strategies work with them. And we also understand that when we talk about emotional health, we're also talking about having people have a sense of self-worth, right? Helping people to be able to understand. In the literature, when they talk about emotional health, they're also, part of that work is not just self-worth, but understanding how to forgive and also offer apology, understanding how to manage conflicts, understanding how to be giving and supportive of others, as well as protecting yourself in that process. And so essentially what we are trying to help our students and staff do, and you'll see this come out more and more in our discussion, is first, let's self-evaluate. Let's see where we are. And let's also have this empathy and compassion for others, so that we think of others, and when we see others struggling, what do we do to help and to support? And we'll talk about what we do with staff separately to students, because it's slightly different, right? But for both groups, there is a sense of giving staff and students the tools and strategies needed so that they could manage themselves and bounce back. For our students, they will not be with us for long. 3 years is not a long time. And we want them to have the tools to go out into the world and not only get a job, but we want them to live independently. And part of that independence is knowing who they are and what they need to be healthy and have emotional health. Advance, Maite, please. So as a clinician, we say that what we think and feel, it's like this wheel, right? They interact, behaviors interact, and spins out of how we are thinking and feeling. And so part of what we do as a clinician is be able to help our students, and in some ways our staff, focus on their internal dialogue, understand and identify their feelings so that behaviors can be managed. And this is a clinical concept, and this is what we speak with individuals in therapy, but now we bring it into the wellness realm so that we can give staff and students language about this, so that we can speak openly about it. And so that's what we are going to be talking about. How do you notice where you are emotionally, identify where I am with my experiences and feeling, what am I thinking, and how do I modify my behavior so that it doesn't hurt others or myself. Advance. And I think the common types of challenges, and what I did actually was, we just threw this on a slide with no order, saying students get these, staff get these. We all can get these, right? Whether you're a student, whether you're a parent, whether you are a staff member. But we typically talk about burnout, secondary traumatic stress, compassion fatigue with staff. And we'll go into what those mean in a second, so that we are working from a shared definition about those things for stress and burnout. But we tend to think of only students having anxiety and depression and intrusive thoughts, but that's not true. We can all have that regardless of whether we have a disability. And so our idea is that we give staff and students the same tools to be able to manage any common challenges that comes their way. And so you'll see as we go along that, yes, for the purposes of this presentation, we sort of break out depression, anxiety, intrusive thoughts for students, and the bottom, secondary traumatic stress and compassion fatigue for staff. But I want you to just to have some order in the slide deck, but I really want you to understand that this can flow freely between any group of folks we're talking about. Forward, Maite, advance. So when I've mentioned this earlier, a part of our vision is to have our individuals with developmental disabilities, intellectual disabilities, autism, all of those types of disabilities really live a healthy and engaged life, right? And I mentioned earlier that health moves way beyond physical health. Health is healthy relationship. Health is emotional well-being. And so since this is a core of who we are and what we want to put out of there, what we have done is language around well-being and health is interwoven in everything that we do. It's interwoven with the supervision of our staff. As a clinician, I take the quote unquote temperature of both the students and staff. Maite does the same. And we train our staff to be able to look for some of these signs that we want them to be aware of. We also are always talking about, I have no shame saying I have been in therapy. As a mother of a child with a developmental disability, the road has been long and difficult. And so there is a lot of work around stigma reduction with mental challenges. And so everything is woven into our team meetings, into discussions with students, as you will see. But I wanted to give this idea that you cannot separate wellness from what we do. It is connected. Move on, Maite.
I just want to mention one thing on this slide. So I think one of the things that Nicole, as the director of Embrace, has really created is a culture of comfortability with especially with the staff being able to say, hey, I need a mental health day today. I just can't do it. And I think because Nicole herself has been vulnerable and has talked about what she just mentioned, having no shame and saying, listen, I've been in therapy. And really, when we have team meetings, taking everybody's emotional temperature to say, hey, how's everybody doing? Is everybody okay? I think that has kind of opened the door for the staff to feel comfortable enough to reach out to us as supervisors and say, I just can't do this today. And we have been given the flexibility to say, okay, the staff can take a day off. We'll figure out, who's going to take over, what if things need to be done, and kind of have provided that comfort level and that ease for staff not to be stressed out and fearful, I think at least, of contacting one of us and saying, I can't do this today. Like, I can't, I have too much going on. And not that we're intrusive in asking them 100 questions, but I think we've opened up that door. And I think a big part of that comes from leadership, right? So with Nicole's leadership, she's created that culture of it's okay to not be okay. Sometimes we're human beings. This work is very challenging. It's emotionally draining. And we need to be able to take care of ourselves to be able to help the students, right? You can't drink from an empty well. And so that is something that's really interwoven within our team and what we do, and even with the network of professionals that we work with, like the other mentors that work in the program, the faculty mentors that we have. And we're constantly doing this, I think now, kind of just on an instinctual basis, because we've been so accustomed to doing that. But and I think that's imperative. There has to be a culture of comfortability around talking about these subjects that are not, that carry a lot of stigma, as Nicole said, and they're not always easy for people to talk about. Because it puts you in a vulnerable position. But I think that culture has been created on the team, which helps people say, okay, I can't do this right now. I'm just not in a good place. So I just wanted to bring that up.
And I think, Maite, thank you for saying that. The other thing is we have to realize the world we're living in, right? So COVID is not an easy time for any family. Our team has been hit particularly hard by COVID in terms of personal. And we have to recognize that if you want to have your team produce, you've got to support people where they're at, and you've got to meet them where they're at. And we are doing that. And the other thing that I would encourage folks to think about is, it doesn't matter, in our team, it doesn't matter what the titles are, right? I will do what I need to do to support somebody who's running seminars and groups. I will jump in and run seminars with the students. It is not about title. It is about supporting each other and creating a safe zone that anything can be discussed. And if staff want to share more than we can ask, then that is embraced, literally, but we support them. And so I think that. And then what we have felt over the time is that it has created a buy-in to the mission and the vision of who we are. And we cannot value each other as professionals and say that we want to have an inclusive program and our students can be like anybody else and not value their mental health as well, and not value their wellness, and give them the same level of comfort and support they need to be able to manage life from a wellness perspective.
Nicole,
so, yes.
Are you okay with the question?
Yes.
A question in the chat box: how do the students respond to the sudden change in staff? And I'm sure they're talking about Maite's comment about, when someone's not there on it.
Yeah. So we do a couple things, and Maite could join in on this as well. And I see another, does it increase behaviors due to fear of pandemic? I think when we go through the student section, which is next, we can weave that question in there. But so our staff has been stable for a while. And the good thing about what we are doing is we are exposing staff and building trust across the range of staff. And we don't have a problem. Students will ask, well, why is Maite not here? Well, she needs a day off. She needs a wellness day. And so we are not afraid to use certain language, right? We're not afraid. Now, we don't give away what is going on with the staff. The staff themselves could say to a student, I had a family member die and I needed something. Right? I don't know how this happened, but recently I was in the hospital. I had 2 hospitalizations, not for COVID. And I was in the hospital and I was doing check-ins with a student because Maite needed time off. And I took some of her stuff when I was doing check-ins. And the student said to me, I heard you were in the hospital. And I said, yes, I was not well. And I needed to take some time to care for myself. And, and so for us, there is no fear about talking about wellness. Now, I would encourage you to keep boundaries with the students. So you should not go beyond certain boundaries. But certainly, you should not be afraid to use language, particularly when you have a death in the family. No, I'm really sad today, and I just need to be alone. And we have our students giving us back that language themselves because they understand it and they are not afraid to talk about their feelings. We have a program for students with autism, and you never hear students with autism talking about their feelings, except now with us, because we have gone through, and I want Maite to get to the next piece where we show you how we do it with them. It's a structured intervention that they own, that they bring out when they need it, and the staff uses the language. So there is freedom in the language. So let's advance, and then I know more questions will be coming out after that. So I want to say one thing about student wellness. Just like I said, for me personally, my health and well-being is just as important as every single staff on the team, regardless of titles. This student health and well-being is the cornerstone of, I think, all the seminars, because if we do not teach students how to advocate for themselves, how to manage some of these emotional challenges that they have, they will not be successful in their jobs. They will not be successful in relationships. And I have to tell you, I think the students are going home and using language that really parents are, pardon my colloquialism, right? Freaking out and calling us and saying, what's going on? Well, we're doing this. It's okay. And parents are now having conversations with their sons or daughters that they've never had before. And so this concept of health and well-being is a focus of how we introduce it in our program for students. Go ahead, Maite.
Go ahead.
Go ahead.
So there, like Nicole said, this idea of wellness is interwoven even at the beginning before the students even come into the program. So one of the things that we do as part of the admission process, which is very long, is that we have the FIU Center for Children and Family conduct a psychological evaluation on every applicant, not only to ensure that they meet criteria for ID or for our autism program, but also to evaluate for any kind of mental health issues that may exist, so that we're sure that we are able to connect them to the supports that are necessary for them to be successful. And then we also have an admission selection committee that meets, that has different partners on it. And we discuss that when we're making admission decisions. We talk about, okay, based upon the psychological, do we have the network of supports that we can refer to or available within the program to support the student with things that are happening. So, again, like Nicole mentioned, in COVID, there's a lot going on right now, even for our current students and for students that have applied. There's families that have terminal illnesses. There's a lot of families who have lost their jobs, and obviously all of these stressors affect the students. And so what we're doing is saying, okay, we need to make sure that, so-and-so whose parent has now been recently diagnosed with a terminal illness, which came up as part of the psychological, we can refer so-and-so for mental health services. Let's talk to the parents about what other supports may be needed, because we want the student to be well from this holistic perspective, right? Because if they're well from a mental health perspective, and then they'll be well from an educational perspective, and they can come to us to help refer to some of those supports if we don't have them that exist already. The other thing that we do is we have team meetings on a weekly basis where we discuss each student in the program, and we get feedback from the different mentors that work with them. including our faculty mentors, academic mentors, and the staff, the job coach, this program specialist. And then we identify if there's any issues going on. So those identified behaviors. So if a student is more withdrawn during their academic mentor sessions, they're not participating in seminars, those kinds of things are a red flag for us to follow up and have an individual meeting with the student to say, hey, is something going on? Or if it's interfering with their ability to participate in the program, then we might also say, hey, maybe we should bring your parent into this to kind of figure out if there's something else going on that we might not necessarily know about, but those behaviors are kind of starting to come up as part of the program. If a student is receiving mental health services, because that's not something that we provide directly, then I usually have a monthly meeting or the program staff does with the mental health provider to just discuss how they're doing in the program, and maybe some things to look out for, or the clinician might have some questions about how they're doing. Again, it's the approach to make this more of a holistic approach to provide the supports necessary to the student. We also incorporate this in our person-centered planning and establishing goals with the students and where they want to go and what they kind of want to do long-term and short-term. And then I'm going to talk about WRAP in a little bit, which stands for Wellness Recovery Action Plan. So,
Maite, what I really want to say here is that so some of the slides Maite is going to go, just so that you're aware, a little bit faster than typical because we want to get to the nitty-gritty of WRAP. But I want to say one other thing. Maite mentioned that she does monthly team meetings with the clinical folks. That is our medical, that is the Embrace Medical Practice, Medical Center. So there is a release. I don't want you to think that we're not managing her and all of that kind of stuff. But you can create a link and a relationship with a clinician in your area and have developed a release so that people can speak. It's a little bit different for us because it is the Embrace Medical Practice. And so I'm sorry, Maite, I'm sorry to interject. Go ahead.
No, it's okay. But I've done it with the private clinicians before too. I don't know if you remember, but we've established that. So I'm going to kind of run quickly through some of these slides because we want to leave enough time for questions. But basically what WRAP is, it's an evidence-based practice that's geared towards helping you identify some triggers to when you start getting upset, identifying a plan to what to do when before you get to the point of no return, basically, and you're totally not in control of how you feel and what you're doing, and then having a crisis plan of what to do then, who are your supports and all that kind of stuff. And this can be done for anybody. This was really started in the mental health system of care, but this WRAP plan, everybody has a WRAP plan. And I'll walk you through just really quickly kind of some of the things that we do to do this with our students. So again, I said it's used by people in all kinds of circumstances. One of our staff is a certified WRAP trainer. And so what we did this year is we broke it up into we broke up WRAP into kind of smaller, more digestible pieces of training for the students. And then I was in all the WRAP groups because there's a lot of clinical things that can come up. And then the students developed a WRAP plan. And so we do this at the end of the first year of the program. And then every year it's kind of reviewed and updated because circumstances change. So again, a WRAP is designed to discover your own, safe wellness tools, identify triggers or early warning signs. What are the behaviors that you engage in that will tell people when you're getting to that kind of point of no return, creating a crisis plan, which is the most important piece, and then developing a post-crisis plan. And then these are some key recovery concepts.
Can I jump in for here? I think we could tie back the question that Gwen asked, which is, have you seen an increase in student behaviors due to fear during this pandemic? And yes, we have, and we've incorporated, so we deal with it two ways, where students are able to talk about their fears and what triggers them during this WRAP process, and Maite will go more into the WRAP process, but also when we recognize that this fear can move into a clinical range, we do two things. We figure out who that student is most connected to. And we have one student that's had a fear that and I'm just gonna, I'm just gonna put out one of the students' fears, and he was so afraid that the election wouldn't go how he wanted and he would have to move to Canada, right? And for him, he needed to make a plan to move to Canada. You need, and this individual has a lot of intrusive thoughts and all of that. And we had not yet done the RAP plan. And so with that individual, we had many touch-based sessions with different staff to be able to keep engaging him. And then when it got to a certain point, we referred him to mental health services through our medical center. But he also discussed some of these things in the development of his RAP plan. And so there are multiple opportunities in the program to address fears and intrusive thoughts, regardless of whether it's attached to a pandemic or something as simple as the elections. And I don't mean to downplay the elections, but it could be a simple thing or it could be a large thing. We have multiple points in our program to address it. Go ahead, Maite. I'm sorry, I didn't mean to interrupt you.
So these are the basic components of the RAP plan. And again, all this will be available to you through WOVA, the presentation. But these are the basic 5 components of the RAP plan. Again, there are the stressors, the early warning signs. How do we know when things are starting to fall apart and break down, which is, when people are kind of getting to that breaking point. And then what is the crisis plan? And one of the interesting things about the crisis plan is really, does somebody have to take over certain responsibilities for you? Who is that person and what kind of decisions are you allowing them to make for you through your RAP plan? And then the post-crisis plan is,
hold on, Maite. But this is a self-advocacy piece of this plan. So the plan itself, when Maite goes through it with the staff in the groups, they are telling us, and right. We may have a conversation with them to unpack it some more, but they are telling us each of these things. So early warning sign, they may not be able to get, and Maite or the staff member may say, well, when I'm getting upset, my ears turn red. So you tell me what you think are some of the things that happens for you. So it's a self-reflection, self-identification of these things that is documented in a plan. It helps the staff understand where each student is when they are getting upset, and we know what they want us to do. And they are driving both their individual strategies and any interventions that we may have to give.
And I think one really, really important thing that that came up that I shared with the team, and especially the administrative team during RAP that we just finished a few weeks ago, is the importance of the staff share when this RAP plan, when the staff are training, the students, the certified trainers, and everybody should be doing a RAP plan. So when I was participating in it, I was saying, well, these are the stressors for me. So Marissa, who's our certified RAP trainer, would say, would prompt them and say, okay, these are what stresses are. This is what they mean, the definitions. And then, who wants to share? And I would always share what I felt, because I think that opened the door to the students seeing us kind of in a different life. There's trust created there, because this is a very, you're talking about vulnerability, you're talking about very personal things in this, but that group dynamic, when the staff participates in that, is really important. And I shared with Nicole and Crystal that after I started, doing the participating in the RAP groups, because I don't participate in all the seminars, students who never reached out to me before were reaching out to me a lot to just kind of chat. And I think part of it is this: we're showing the students that it's okay to be vulnerable. We're vulnerable too. We stress out too. We have our breaking point too. And that's a really, really important piece of when you train in RAP, at least for our students.
And I think it's the normalization, right? That we all have anxieties and fears. So too often, our students are described as other or different. And this sort of levels the playing field that we are all the same, guys. We all have stress. We all have anxieties. We all have worries. And by the way, just like you can use this, we can use this. Now, I would caution you to say that you should think about what you want to share. in that group so that you're not crossing a certain line, right?
Right.
You don't want the students to know certain things about you, right? And so there has to be a plan and a trust among the people, your team members who are doing it, and some coordination of how we're doing this. Sorry, Maite, go ahead. I don't know if you want to advance or if you want to stay here.
Yeah. So the post-crisis plan is basically, after the crisis, how do I get back to being okay and kind of maybe repairing some of the relationships that I might have damaged during the crisis. So if I cursed out my mom in the middle of a fit of anger or whatever, this is kind of like the coming back to say, okay, now that I'm clear, I need to kind of, repair some of these things. And what am I going to do after the crisis to kind of get back on a plan of wellness? Okay, so let me share just really quickly.
So while Maite is pulling this up, I want to say that the RAP plan has certain components, and Maite, go ahead and pull it up. I'll talk while
Can you see the RAP plan now or no?
You have to stop sharing and
I have to stop share and restart. Hold on.
But while she's doing that, this plan could be developed in any way. You can do art drawings, they can draw the pieces, they can do cutout, and it doesn't have to be written like this. This particular student chose to do this, right?
Yeah.
So go ahead, Maite.
So these are the different components of the RAP plan of this particular student, right? And so like Nicole said, sometimes they might not know how to answer certain questions. So after they work on it in this group setting, then we have individuals with meetings with the students when we review the plans to make sure that they're really answering the question that's being asked. We might have to prompt them a little bit and ask some more questions. So like these are the different coping skills in this student's toolbox. Their daily maintenance plan, which is basically how do I stay well every day? There's certain things that I have to do in order to stay well. So, brush teeth, have breakfast, this kinds of stuff. Things I need to make sure every day to stay well, make my bed. If not, it's going to bother me. Then there's some that you do occasionally. The triggers are really, sorry.
1 second, Maite. I want, as people are looking at this, I would encourage you, because this is what we do. We look for themes across this, right? And I'll tell you a theme that I picked up after reading this particular RAP plan. So as you're going through, look for themes, because then that becomes a discussion within the staffing structure so that we know, okay, so-and-so needs this. This is a theme for him, okay? Right. Go ahead, Maite.
So then you identify triggers in different areas. So there's some that are triggers at home, some that are triggers in the community, at work, or the doctor. Also, if my trigger happens at home, this is what I'm going to do. So how are they going to react depending on the place where they're at if they're triggered, right? And then there's some early warning signs like this one, my ears start to get red. I keep to myself, I'm a little bit isolated. If I'm starting to clench my fist, things are getting worse. So now we've escalated, right? If I'm hyperventilating, like, wow, right? And then they identify when they're in a crisis, who are the people that can help me, right? So like they've named the staff and then certain people in their life. But then there's certain people that you might not want to be near you for whatever reason in a crisis. The things to do, things to not do. And then when I'm feeling better, I'll stop with the breathing hard. My face won't be red. This is how people will know that I'm no longer in crisis and I'm kind of starting to get into a better place. And then this is what I was talking about is sometimes, these are the people I need to apologize to because these are probably the people that are closest to me that I've maybe done some damage to when I was in my crisis. And I also have to thank these people for their support. And then there's some reflective questions once you have the crisis. What did I learn from this? What do I need to do to change? And so this isn't done yet because the student has not felt that they had a crisis yet. But if they had a crisis, we would follow up with this piece, right? To help them kind of take that crisis apart and figure out what did they learn? What are my goals? Did I contribute to this in any way with any choices that I've made and so on and so forth.
So before we move on, if you think back to the slide with the gears, right? Thinking, feeling, behaviors, all of that is in the plan. They are looking at what physically happens to them. What are their thoughts? right? And then they actually acknowledge the kinds of things that they do. And then, of course, we go back to how do we rectify relationships and apologize and speak to the people that we have hurt. That is part of maturity and growing up. And it's also how can you, when we talk to them about what happens to you physically, we also are trying to get them to stop from moving after a certain point, right? And this is done in a group with all students. So if you could imagine, if Maite and I are students in this classroom and Maite sees my ears red and she knows from my rap plan, she's going to be able to, hey, Nicole, let's go ahead and have a conversation, right? If it's a staff member, student may intervene and provide support. And students then will understand that if Nicole behaves in a certain way, I have more empathy and more compassion. I was in the group when Nicole was doing her rap plan. And we actually use the word rap plan. We use the word wellness. We use triggers, the same words and dialect that you would get when you are in therapy, right? Because then if you have to get mental health therapy, you got to know the language to be able to, move forward. So let me take a break here. And I see that there are some questions in the chat about, before we move on to staff, about the students. How long does the group sessions end? Well, it's about a week, but it could go on, right? It's sort of like it's a psychoeducational, but a process group where you're trying to get them to a certain point of not just understanding, but integrating the information, right? And you may have to pull people out one-on-one to be able to discuss things more so they could catch up with the group, or you may have to slow the group down. As a psychotherapist, I could tell you there is a lot of positive work that occurs out of the group and the support of each other. The students begin to bond more and understand each other better. So this can take a week, it can take 2 weeks. It just depends on what the group is. Maite, how long did we just did rap plans? How long did we take?
So with the rap training that we did for the students, Marissa, correct me if I'm wrong, but I think it was like 3. So we have 3, 6, it was 9 seminar sessions for like an hour and a half, 2 hours each.
Right.
That's correct.
Over a 3-week period. Right.
Okay.
So we did 3 sessions each week, each for an hour and a half, 2 hours. And the part of that was creating the rap plan. And then we followed up individually with the students to make sure that, they submitted their rap plans, and then we took a look at them, and then we followed up with them to just make sure that they really understood everything that was being asked. And we helped them kind of put things into words and that if needed. Right. Some of them needed it and some of them didn't.
And all the staff have access to the rap plans, right? And so we know what to expect from our students. The resource for this is on the reference page. You can just go to Wellness Recovery Action Plan. It is an evidence-based practice by SAMHSA. Mary Ellen Copeland, a psychologist who had a schizophrenic break, actually developed this for anyone to use. And in the future, we will be looking to co-facilitate this rap group with a student who have already done the rap plans, because you're supposed to be co-facilitating and not just doing it on one. So let me move on to the staff piece. And then, yes, this is something that the program should try yourselves. And if people want to talk about it some more, we're happy to have a conversation either after this week or even after I finish this presentation. So there is an organization wellness. And when I speak to an organization wellness, I'm speaking only to Embrace. I'm not talking about a university wellness. The university, all universities have a wellness plan and they have different things. We bring that into what we speak to our staff about. And I want to talk about compassion, fatigue, and secondary traumatic stress. It's something we do not talk about go to the next slide, Maite. It's something we don't talk about with this group, right? And I could tell you as a parent myself of a young lady with a disability and having moved through what I consider to be a traumatic experience from birth to 29, I am at risk for getting post-traumatic stress, right? Because every time I listen to a parent and their experience, every time I continue to interview parents and they talk about distress, I am particularly vulnerable, but so are our staff who are hearing this information over and over and over. And so one of the things that we have done on our team is make the management team acutely aware that during admission times, when we're reading psychologicals, when we are listening to these stories, that we are focusing on those families that heavy duty trauma, because that trauma is going to be coming up throughout the experience of the young adult in our program, primarily because most of our students, and I don't know about yours, but most of our students are not in therapy and have not gone to therapy or can find a therapist who can work with a young adult with a developmental disability. And so that is the challenge. And so we are acutely aware of what could happen to us as individuals and our staff as we move through. So could we go on to the next slide?
Wait,
So
Nicole, can I just give a quick example on this last one? So there was an incident that happened earlier this year with one of our students that ended up in the student being arrested by police. The incident was terrible, and was recorded
by police during the arrest. So I think we need to put that out. Yeah.
Right. So we saw it on the news, basically, is how we found out about it. And it was a very, I think I could say for the whole team, it was a very jarring experience, even though we didn't live it with the student, but we lived it as a staff. And one of the important things that Nicole did was bring in, I think it was EAP. I don't remember what department they were, but basically there was a debriefing with a psychologist from EAP with the staff, with all of us, to kind of walk us through what had happened and how we were feeling about it as staff, as parents. So, there's a lot of staff with parents on the team, and watching such a traumatic event happen. And I think that was really helpful for us to kind of decompress, address the stress that we were feeling, the secondary traumatic stress from seeing this happen to one of our students, and also being able to kind of bond over that and move forward, right? So I just want to say that was something really jarring that happened, and I think all of us were really impacted by it because of watching it. But that debrief with that psychologist was very, very important for us to kind of be able to kind of just let it out of what we were feeling, the secondary traumatic stress from that incident.
That's a good point. And actually, I want to say to the directors in this meeting, in this training, that for that incident, I actually went to the jail, and Maite and Crystal were on the phone. We were up till I think 2 a.m. and our work was getting the student moved from general population right, into a secure area. And I was with the parents. So from the time we found out about 8 or 9 to 2 o'clock in the morning, I was with the parents, sort of doing this helping them through managing emotions. Maite and Crystal working in the background with me to move the student out of general pop. And so we have to understand, as directors and managers, there is a heavier burden that we carry. And we have to be open to discussing that burden with everyone, because it doesn't make us stronger and it doesn't make us better because of our title. And if we are to stay healthy and to be continuing to give and continuing to do this work, we have to be able, regardless of the title, to put it out there. And I would say to the directors that are on there to just sort of just think about that, right? So I'm just going to leave that there.
Nicole, we have 8 minutes, okay? Time check.
Okay. So could we
Sorry.
not do burnout and stress? Could we go down a little bit? I wanted to put this on there. These common symptoms are both for staff and students. You will see this, right? You would see a numbing of emotions. You would see sleep disturbance, eat. I would say to directors and people out there, we do this all the time as managers. We take a temperature of our students, of our staff. We go in, we listen to them, we get a feeling for what is going on, and then we have to do something in return. Maite, could you forward? I want to move to a particular slide. Go ahead. Keep going until I tell you to stop. Keep going. One more. One more. Stop. Go back. Since I only have 8 minutes, I want to put this. Go back.
This one?
No, the one with the individual strategies and the. No, go down. It's just before the reference slide. So our approach, this is from the National Child Traumatic Stress Network. Everything I'm telling you is evidence-based. It's been studied. And actually trauma is, as a clinician, is something that is in my wheelhouse. And there are things as a department we have to do. And there are things as individual staff, we have to give space to our staff to do. And we have to also do it ourselves and demonstrating that we're doing it, right? So that's staying connected, that understanding when your staff is to the point that have been working overtime, you have to stop them. And I cannot tell you how many times I would say to Crystal, who Maite reports to, and say, that's it, Maite needs time off. This is what I'm noticing. And we do it for each other. It's not because of my title that no one does it for me. Marissa or Galen or any staff, regardless of title, can do that for me when they say, hey, I notice you're jumpy, I notice this. And so you have to be able to put yourself out there as a director. And also as a director, you have to understand what your limits are and where your flexibility is. My staff knows that I am completely flexible. And it doesn't matter, it's something for your mom, it's something for your kids, it's whatever. That kind of helping them reduce stress brings forward a little bit more empathy and gives the individual some time to decompress. Sometimes because I'm not in the office and I cannot physically as a psychotherapist sort of take the temperature, I have weekly Zoom meetings. It's not the same. And sometimes I will send an email to say, we'll do 10 minutes of work and we're gonna do a happy hour. It's not, it's nothing wrong with that. We have to come up with creative ways to continue to build team membership and support where people feel that they can hold each other accountable for their wellness. I'll give one last example from a director's perspective is that I have a physical disability. I wouldn't even call it a disability, but I have rheumatoid arthritis. And I moved from doing medication orally to infusions. I discussed that openly. I discuss what I need to be well so that I can work with my staff openly. It's not that I expect my staff to discuss their personal business, but I'm hoping that they will incorporate some wellness stuff in and balance in their life. And with that, I'm sorry I didn't get through everything. It's packed with information. Maite, myself, and the team are available to answer questions even after this presentation. And you'll get a slide deck. Go ahead.
I just think we need to mention one more thing about RAP. So we just need to clarify that because RAP is an evidence-based practice, somebody needs to be trained, a certified trainer in RAP, which we sent Marissa to. You shouldn't just fill out the RAP plan just like that. There's a whole training that goes behind that to be able to create the RAP plan. And we have a certified RAP trainer on board that was trained properly through the Copeland Center to be able to deliver that material in a specific way. So I just wanted to clarify that too.
Are there where is the training available? It's all over United States. If you go on the Wellness Recovery Action Plan website, it's everywhere. We tend to wait for the training. We're going to train another person, and we're going to wait for the training to come up in Florida again. Otherwise, you'll be flying people around the country. So, you know, I don't know. I'm sorry I ran out of time. I was trying to get too much done. Drew, we can't hear you.
Thank you. We do have about 2 minutes. If anyone has a quick question, or if someone would like to unmute themselves. This has been so helpful, Nicole and Maite. Thank you both so much. I mean, great information. I was thinking myself, I actually was writing down all these resources, and I'm going to go back through the PowerPoint because it's just, you know, it's so important to students. Mental health is important to all of us, especially in times like we're dealing with right now.
And I think, you know, even just one last thought, even, you know, I have a daughter in the public school system, and I have a lot of teachers who are friends of mine that work in her school. And, you know, I was telling them that right now is not the time to be stressing these kids out, anybody with these academics. They need to understand that there's parents that are suffering. You don't know what's going on in anybody's home, right? We don't know if people have passed from COVID, if they're sick from COVID, if parents has lost their jobs and are at food banks, you know, looking for resources to put food on the table. And, you know, I always think about Maslow's hierarchy of needs, right? If you don't have food, shelter, and clothing, then you can't be expected to self-actualize and have insight and develop all these things. And I think we need to be very, very conscientious of taking the temperature, not only of the staff, but of the families that we serve also who are struggling. And that's huge. You know, COVID has changed a lot for everybody, and there's more stressors now than ever for these families. And I think we need to be flexible and take that into consideration as we're creating these expectations for students to do certain things, but their families are also going through a lot, you know, as are ours. So I think that's an important thing to also think about.
I want to remind everyone that the Whova app allows you to send a message. And so both Nicole and Maite are both listed as participants. You can message them. This presentation was recorded, and so it will be posted and will be available sometime next week. And also the resources there in the session. And we have about a 15-minute break, and then there are 2 sessions that will be beginning at 11:15. Thank you for your participation. Thank you, presenters, for bringing such important and timely information to all of us.
Thank you, everybody.
Thank you for the opportunity. We really appreciate it.
You're welcome. You're welcome.
Great presentation. Thank you.
Thank you.
Bye.
Bye.